Hey everybody. Okay. So this week I have a sudden idiopathic sensory neural hearing loss. Okay, there we go. What is it? So it's pretty much in the name. Sudden sensory neural hearing loss. So it's hearing loss that occurs suddenly all at once. It can also occur within just a few days, so it doesn't need to occur all at once, but it most likely does. And then signs and symptoms of this hearing loss, obviously sudden impaired hearing ability. Um, some sites said that patients might experience a popping sound during the onset. A lot of patients who are diagnosed with this actually wake up with the hearing loss, but some do actually like feel the popping or hear the popping sound as their hearing is lost. And then some other signs and symptoms are dizziness, tinnitus, fullness in the ear, and pressure in the ear. And then some statistics. The incidence is about 5 to 10 per 100,000. There's about 4,000 cases per year in the US. The book I got that from is a little old, so I imagine the cases are higher now. And then the peak incidence when this like most likely occurs is between the fifth and sixth decades of life. I saw something that said their patients they see are most often between like 30 and 60, but more like in their 50s, 60s are the most often, but it can occur to anybody, any sex at any age. And then it usually just occurs in one ear, and only 2% of less than 2% of patients who are diagnosed with sudden idiopathic sensory neural hearing loss actually have the diagnosis in like bilaterally in both ears. The etiology, it's most often unknown, unfortunately. Most doctors are only able to what's that called? Like diagnose the cause to 10% of their patients. So some known causes are ear infections, head trauma, autoimmune diseases, exposure to certain drugs, blood circulation problems, specifically like abrupt disruption of the flow of blood to the cochlea, some neurological disorders like multiple sclerosis, and disorders within the inner ear like Meniere's disease. And then diagnosing, so your audiologist will do a pure tone audiometry, and this way they can roll out conductive hearing loss, so that they know it's sensorineural. And then they have to have a loss of at least 30 decibels in 3 connected frequencies within 72 hours to be diagnosed. So I'm not exactly sure because like we're not really getting our hearing tested often. So like how do you know if the patient has lost that much within 72 hours or if they just have lost that much hearing since their last hearing test? Like I'm not really sure, but I don't know. It's what the website that I was on said, so I figured I'd list it. Um, and then for them to like localize the cause, a lot of doctors will request blood tests and imaging, specifically magnetic imaging and MRIs, and some balance tests. And then treatment and management. So the most common treatment option is corticosteroids, just to reduce inflammation within the inner ear, decrease the swelling, and help the body fight off any illness. Another, I guess the second most common is the antiviral medication. So not everybody, not every patient who experiences this is actually put on medication. Like some people can experience sudden deafness and then regain their hearing within a few days without being put on medication. But those who do experience it and are put on medication, if like it's typically the less hearing that they've lost, if they're put on medication within a few days, then it usually has proven that their normal hearing, they can regain their normal hearing within a few weeks with the help of those medications. But unfortunately, some people don't regain any of their formal hearing, or they only regain part of their hearing. And then this is a video I found. It's some like interview with an ENT, and he's basically just explaining what, oh my goodness, he's just explaining what this is, but I thought it was pretty interesting. So let me share it. Okay.
It is a little bit startling. How often does something like this happen?
It occurs in about 1 out of 10,000 patients in a year. So if you're looking at an area like Central Florida, we're looking at maybe 100, 200 people. But in the U.S., we're looking at anywhere from 4,000 to 25,000 people this occurs in every year.
And what kind of is there? We talked about what happening sometimes without sudden warning. Are there any symptoms or anything you should be looking for coming up to this?
Unfortunately, most people kind of wake up with it in the morning and all of a sudden they can't hear. So the prominent symptom is a fullness or pressure in the ear. Things feel not right. They can get a loud ringing or tinnitus in the ear. Some people even feel dizzy or off balance or have vertigo as part of it. And the level of hearing loss can vary. It can be a mild loss or it can be total deafness in the ear. And it's just like that, sudden. And for most patients, there's not a specific etiology we can identify. Most people think it's from a virus that got into the inner ear and caused the damage.
But it could also be from trauma, perhaps a loud sound, explosion, anything like that.
There's lots of causes. The most, the most common is idiopathic or known. But you could have simple things like wax in the ear, fluid in the ear. That's not really sudden sensorineural hearing loss. That's other causes of sudden losses.
Are there age groups that tend to see this more than others?
Sure. The most common age group is in the 50s, but it can occur in childhood or adults. There's not a sex variation, so males and females get it equally.
All right, and what about treatment? Is this fixable?
Yes and no. It's a type of nerve damage that occurs in your inner ear. So steroids are the primary treatment currently. That can be given orally or even actually a shot in the ear.
Okay, interesting. Well, let's hope it doesn't happen to us, but you're the guy to go to if it does.
Okay. So, yeah, I liked how he explained. And then here are my references. I hope you all have a great week. All right, see ya.